I wanted to talk a minute about spinal damage. When people are experiencing spinal injury, they hear different things. You might have got a disc bulge, a disc herniation. I did create a whole video on that. But you also might hear the term degenerative disc disease, spinal stenosis, those kinds of words. Now, if you've heard those types of words about yourself or a loved one, I'm going to spend a minute and explain to you what that means and what's happening in the spine. So when we're talking about spinal degeneration, what that typically starts as is it's an initial injury that happened many years ago. And once you have that injury, you develop scar tissue and your body senses that injury and your body can't heal it all the way properly. So what it begins is a slow progression of that joint breaking down over time. Now that doesn't happen just in the spine. It can happen in any joint. We see it all the time in knees, we see it in shoulders, elbows, wrists. It can happen in any joint in the body. The word they use in other areas of the body is the word osteoarthritis, which is just a gradual degeneration of a joint due to years of wear and tear. Now, in the spine, it has a specific name for itself called degenerative disc disease. I have a model here of degenerative disc disease. As we look at this model, you can see here you have a healthy spine, healthy disc. So what you have is the bone here, the disc there, and the nerve coming between the bone and right behind the disc. On the initial stages of damage, you may get a disc bulge or herniation, and that would be seen more on MRIs. In fact, you look at the x-rays might look okay. There's good disc spacing and everything looks okay. But when you get an MRI, you notice that there's a disc bulge or a herniation where the disc material is pushing out into the nerves. Now, as time advances and that process continues to get worse, it begins to look like this, where you get larger spurs that develop. The disc begins to break down, the bulges may get worse, and then the nerve starts to get more and more impinged. At this point, you may have back pain, but you can even have back pain in the first stages, early stages, you have back pain. Here it might be getting worse, maybe going further down the leg or into the foot if it's in the low back, or if it's in the neck, it might be go further down the arm and into the hand. And if that doesn't get addressed and it continues to get ignored, it can go to phase 3 of the degenerative process. Now, once it's in the later stages, we're almost basically bone on bone at this point. There's very little space for the nerve. And this is where you hear terms like spinal stenosis. And stenosis means you're supposed to have these holes where the nerves come out, and there's the hole where the spinal cord goes through. And those holes, because of spurring and degeneration, begin to narrow and get smaller and smaller. And as they get smaller, they start to stenose or pinch down on the soft, delicate nerve tissue inside. So the best place to start with this is in the early stages, take care of your spine, obviously. I'm a huge fan of that. But as time passes and perhaps you come in, you're already like this, there are some new options now for patients that even have a little bit more advanced degeneration and stenosis. We can combine hands-on work nowadays with regenerative medicine, human cellular tissue product, or better known as stem cells in the United States. We can utilize these to help heal those tissues, speed the healing process of the joint while we work on it with our hands, and we're getting some amazing results, some really good outcomes. In fact, cases that we had in the past had to abandon because they just wouldn't respond are now responding because of the stem cells that we're able to use in our clinic. It's been really fun seeing people get better that weren't able to in the past. So I hope you learned something today. I enjoyed taking some time and teaching you a little bit about spinal degeneration.